The United Nations Population Fund aims to raise awareness about issues related to reproductive health needs of women and girls worldwide. The ongoing COVID-19 pandemic has exposed weaknesses in the healthcare systems, not just here in India, but globally. The pandemic has also led to serious gaps in the provision of reproductive healthcare services that are provided to women across the world. And to talk more about the impact of the pandemic on just how it has impacted reproductive health, how it's impacted women and girls, we have Argentina Matavel, representative of the UNFPA India, joining us on the broadcast. Thanks very much for speaking with NDTV. I want to begin by asking you about just how difficult has your job become in a certain sense as a result of the COVID-19 pandemic. How has the pandemic impacted gender inequities?
Thank you very much, Rishika, for having us at UNFPA. Indeed, all data, preliminary data that of the impact studies, surveys that we're doing indicate that the services have been affected. It was worse, of course, in the first 2 months of last year, of the first wave, but very quickly we were able, with the ministry and to put in place guidelines for health workers themselves who were at risk themselves of being infected, to be able to have a bit of confidence to go back. But then the people themselves were also afraid of getting out of their homes to get access. So from the data we have, it indicates that about 60% is what the services were able to get back to right now in terms of all the areas during the COVID pandemic. And this has tremendous negative impacts, because you have, on the one hand, people who want to access the services, and but they are afraid to come out, and the other, the services that are trying to gear up to, their ability to serve the people, but then you're dealing with women and health workers who are themselves being affected and infected. And so it has not been the easiest way. And this has resulted in unwanted pregnancies. And you know what that means for women and girls when you're stuck with an unwanted pregnancy. Number one, the cost of raising that child, the cost to yourself if you were about to get a job or to go out of the house. It is a ripple effect that will affect you throughout your entire life.
Right. And, has accessibility been the only problem? Or, is there a deeper psychological problem that you're going to have to be dealing with as well? Because the pandemic has also made people fearful of accessing healthcare services if it's not deemed essential or emergency.
Absolutely, because even without being the reproductive health services, which are critical, and they do not, when a woman needs to deliver, the baby can't wait until the pandemic is over, but just the fear of being infected at the health facility, because that's what most people think, oh, if I go to the health facility, that's where I'll catch COVID anyway. So that has had a very big impact. We have to be working with the women back to raise their confidence that the health services, the health facilities are ready, that the Ministry of Health and the health hospital directors have put in place all the systems to ensure safety of those who are not coming in for COVID related. So there has been a separation in the services, so that people who need services that are non-COVID related can use separate doors, separate entrances, and all the precautions are put in place. So it's a long, as you say, psychological work that we have to do near the people, the communities.
And in terms of the strides that you've made, in the recent past, how do you believe that the pandemic has set you back? Many say that efforts such as yours have faced, setback by several years. You're looking for an attitudinal change. You're looking to empower women with a choice, with education, empower them economically as well. So how big a setback has the COVID-19 pandemic been, and how many years do you think it will take for you to recover from it in your efforts?
We can't say with certainty because we still do not have data. This is a crisis, a fast emerging crisis that experts around the world and in India itself are struggling still to get the real data, but we can't have full data until the pandemic is over, and nobody knows when it will be effectively over. But we know from anecdotal evidence that this has affected incomes for women and girls, for men as well. But of course, we know who is at the low end of the receiving end of the impact of this pandemic. It's women and girls because of their reproductive role when you have to face issues of pregnancies and raising children and still making an income, and your jobs have been taken away because either employers themselves have suffered because of the pandemic. There's no telling. It's a ripple effect that is affecting everybody, but of course women and girls worse.
The other question that I want to ask you, and it's very important because as a part of the Population Fund initiatives, enabling reproductive rights and choices is also something which is extremely critical. It's at the very heart of the work that you're doing. How do you balance that with population control? And there has been a lot of talk about population control measures here in India, in the last couple of months, some select states looking to push for bills. How do you look at these developments?
Naturally, UNFPA is guided by the plan of action of the famous conference in '94, where 179 governments, member states, have signed an agreement to provide free and choice-based reproductive health services, especially family planning. When now a discussion comes about controls, even looking at India's history, you look back at the 70s and you know that the control measures that have been taken in those days were disastrous for the country, for the women and girls. So to be in 2021 and again be talking about control is unfortunate, and we hope that, and we have produced a technical note and guidance that we deem will be useful for the government that is now of the state that is talking about controls right now. What we need is to be putting services for women and girls to have choices. They need information, they need the supplies, but supplies with a choice, like a basket of contraceptives, not just one type. When women are given choices and information, usually they make the right choice.
Right.
So if the services are there, and if they are educated, because it has been said, and it's true to today, and all the countries that have managed to reduce their fertility, even in the region, we're looking at Thailand, Indonesia, Bangladesh, and others, it has been based on the education of women and girls.
Right.
You have to prioritize that.
It's very, very important what you say, that instead of putting control measures, you need to empower women with education, with information, give them the choice, and most likely they're likely to make the right one. Thank you very much. It's been an absolute pleasure talking to you.
Thank you very much. It's all about rights and choices.
Thank you. Thank you.